lockstep. All right, we've got Representative Robert Johnson joining us now on Middays. Representative, welcome, sir. Thank you.
Thank you. Happy New Year to you.
Happy New Year to you. So you guys are about to, or you may have already gobbled in, right, this morning at 10 o'clock. I think it was noon yesterday, and then you started at 10 today. Is that true in the House?
That's true. We've gabbled in, we've gabbled out. Now we're going into meetings and getting legislation ready.
Okay. What about committee assignments? When does that occur? And a vote for the Speaker?
Well, everyone who was here last year already have their committee assignments, so you already know where you are.
Okay.
We have one new member, and so I don't know if he's assigned him to his committees yet, but we already know what committees we will be participating in.
Okay. So all that remains the same since we're in the same term.
Right.
Yeah. Okay. Gotcha. So what are your legislative priorities for the 23 session?
Well, as the Democratic leader, I think about things statewide and what's affecting people all over the state. And there's no higher priority right now, in my opinion, than health care. And that health care specifically about making sure that people have access to emergency rooms and to hospitals, and at least an area close to where they live. We're in dire straits right now in terms of having people lose hospital services in an entire region. Mm-hmm. And so we need to do something about that. I've talked to leadership on both sides. They understand the crisis, and there is a willingness to do something, at least in the short term.
Okay. Well, this morning, Governor Reeves was on the program with Paul Gallo, and he indicated as well he has those concerns about certainly about access to health care and affordability of health care. And he sounded like he is an advocate for ending the certificate of need laws in the state of Mississippi. What's your position, sir, and what's the general position from the Democrats in the House?
Well, the CON law, it in a lot of respects is maybe too restrictive, but that doesn't solve the problem that we're facing. Our problem is a money problem. Mm-hmm. It's not an access or a licensing issue. It's a money problem. There are hospitals that are closing because they don't have the funds to keep them open. There are hospitals in metropolitan areas like Jackson who are open, but they are severely understaffed in terms of the services they provide and in terms of people providing the treatment. And that comes down to the fact that the majority of the hospitals in this state, probably right at 90% of them, are public hospitals that were formed under the Hill-Burton Act, which received federal funding to keep hospitals open, which means that those hospitals, whether you have insurance or Medicaid or Medicare, if you have none, those hospitals have to treat people if they show up at their doorstep. The problem is that when they do that, they don't get compensated for it, because under the new healthcare system, to receive the compensation for treating people who don't have any coverage, the idea was open up the coverage so that all working people would have coverage of some type. Mm-hmm. And so that funding for disproportionate share funding, uncompensated care funding is not available to those hospitals, so they can't keep facilities open the way they need to, and they can't hire doctors or keep nurses on staff because they don't have the money. So the CON law, I think, needs some work. But if you open it all the way up, if we don't have the money, if the healthcare professionals and the institutions don't have the money to run those institutions, it doesn't matter what you do with the CON law.
So just to clarify, are you saying that there are some that even though they qualify based on the amount of uncompensated care or care they're providing under Medicare or Medicaid, they're not receiving DSH payments?
No, they don't get. They get some uncompensated care, but not to the level, because the understanding was, look, here's money available to you, states. That's available. You got people who are working every day, carpenters, bricklayers, mechanics who are self-employed. They're working every day. Let me tell you what I'll do to balance out this uncompensated care. You can allow those people to be qualified under Medicaid. They're working every day. They're taxpayers. We want to take care of them. We want to keep them healthy. So what we're going to do is we're going to give you $1 billion a year to keep your facilities open, to provide coverage. We're going to give you $1 billion a year to do that. And take it. Fund the coverage for your working people, the 250,000 or more working people in the state that don't have coverage. And that's how you keep your hospitals open. That's how you keep your doctors hired. That's how you bring in nurses and be able to compensate them on the level that they're compensating them in Louisiana and Arkansas and our neighboring states. But if you don't do that, if you don't have that funding, it won't happen.
Representative, are you familiar with the health care provisions that were enacted in the American Rescue Plan pertaining to the Affordable Care Act and the exchanges? And then that was just recently extended in the omnibus bill that was extended, in the Inflation Reduction Act. That was extended for 3 more years. And essentially that allows an able-bodied adult with an income, a household income of less than 150% of the federal poverty level to purchase coverage in the exchanges for 0 premiums. Why are we pushing that as an option to Medicaid expansion?
And there are people who are taking advantage of it, but there are also people who fall outside that guideline. That would, if we didn't have that, then the number would be 350,000 people who didn't have coverage.
So do you have some data on the number of people? Because I've tried to get this data. How many have actually taken advantage of those provisions?
I don't have the let me tell you where I get the data from.
Okay.
That before they did that expansion, before they did that extension, that our number that enabled us to take 100,000 people, because the number was 350,000. Mm-hmm. That made access to health care available to 100,000 people who otherwise wouldn't have it.
Okay.
Now we just need to continue to do that. Working people are not looking for a handout. Working people we just want to keep them healthy. They need to go to a doctor. They don't need to show up in an emergency room with a heart attack or their blood pressure out of control or their diabetes out of control. They need to be going to a doctor where they can go to work every day and make sure they get the maintenance medicine that they need. Now, it's not government's fault that the cost of health care has risen the way it has. I don't know but that's not a Medicaid issue or a Medicare issue either. That's a health professional issue or the access to health care. But I sincerely believe in every state they've done it in where they take this money and put working people in a position where they can get health care. Everywhere it happens, it's a boost to the economy and it creates a healthy workforce. And we are robbing ourselves of an opportunity to create as many as 10,000 new jobs at a payment of $60,000 a year in health care. People that with an 18-month degree can go and do that. And we're not taking advantage of that. And we're also putting people in a life and death situation that they shouldn't have to be.
Gotcha. Representative Robert Johnson, appreciate you joining us here on Middays, and good luck in the session, sir. I'm sure we'll be talking to you further as the session progresses. Thank you, sir. Appreciate it.
Have a good day.
You too. Coming right back on Middays.